Welcome back. It's a beautiful morning to you. 99.3 Nigeria Info is a station for talk. We kicked off the day with a chit chat at 5 a.m. Dailies today came your way at 6, right after the first major news of the day. Tunji Andrews was live with Money, Business, and Economy show, telling you about all the biggest stories that you need to be aware of in the economy business world at 6:45. At 7, Chuma Nolly just did his thing on Sports Drive, representing Femi and the gang on Sports Drive this morning. It's the morning crossfire right now. We're back. Thank you all for being a part of it. You can join the conversation that we're about to start on Facebook and YouTube, because we're streaming live right now. We're live streaming Morning Crossfire right now on Facebook and YouTube. Just search for Nigeria Info 99.3 on these two platforms, Nigeria Info 99.3. Search for it, and you'll be able to watch me live on the show. You can also join the conversation on Twitter at Nigeria Info FM on Twitter. That is at Nigeria Info FM on Twitter. Our WhatsApp portal will also be flown open to you so that you can be a part of the conversation via WhatsApp. Today, we are talking about Corona Quacks. Those stories that you must have heard about. Those people that have told you that they've discovered cure. They found cure for coronavirus, COVID-19. Oh, well, today we'll be speaking with Aremeyaw. Anas, the world famous investigative journalist all the way from Ghana. He joins us right now via Skype. You can see him. Well, not literally. You can see him with his traditional face mask. Anas, a lovely morning to you. It's good to see you.
Good morning, and how are you? And good morning, listener.
I'm doing okay. Let's talk about Corona Quacks, your report this morning. Lagos. Before we get into it, if you've got questions for Anas, send them in via our WhatsApp portal. The WhatsApp line is 0809 597 5805. That is 0809 597 5805. This particularly is in partnership with BBC Africa Eye. So the report broke yesterday. We have Anas on the show today, and it's a pleasure to know that we can get ahead of this particular all-important report here on Nigeria Info. Now, since the outbreak of COVID-19, the whole world has come under pressure to find a cure. The whole world, the entire universe is still under pressure to find a vaccine. Now, while this goes on, have fallen prey to quacks who have fleeced them of their monies and compromised their health in the process. Some have died, as a matter of fact. Now, it's in light of this that the BBC Africa Eye released a documentary detailing the fraudulent practices of some of these quacks, particularly in Ghana. Anas was in Nigeria, by the way. He spoke with a Nigerian doctor, too. We'll be talking about that much later on. The investigative reporter, Aremeyaw, joins us again right now on the Morning Crossfire. Anas, welcome again. Let's start with this, Anas, that your report was such an eye-opener to watch. I mean, I watched it yesterday, like twice yesterday. Even this morning, I've seen that report. Let's begin with this vital question. How has the media fared in the fight against misinformation this period of the pandemic? How would you?
Well, it's very difficult to reach the media because this is an unusual time. Since I was born, I've never experienced a time where I never envisaged that there was going to be a lockdown where I would be told to stay at one place, don't go out, wash my hands as many as I can a day, not less than 10. It's so there are special times, and special times comes with another way of thinking. You see, when most of us across the world concentrated on finding ventilators, sanitizers, and other stuff, because people were dying every minute across the world. We didn't avert our minds, or it was really difficult because the basic instinct of every human being is survival.
Right.
So we were all in that panic mode. So nobody could envisage, let's try and look for quacks. So for me, after days of being in the lockdown, I'm like, well, Corona is Corona. You get it. You get it.
Yeah.
Even after all the safety protocol, how could we also contribute as journalists to ensuring that we still play our watchdog role? The first thing that came to my mind is the people who would always take advantage of situations like this,
Right.
and then fleece people, the poor, out of the little money they have. Then I started looking into cures. Like you said, Dr. Abodo in Nigeria, he's a pharmacist. He says he has a known cure for corona. He can also cure HIV, AIDS, and all.
Yeah.
But we all know that
When you did that report, what did he tell you? What did you find out yourself,
yeah,
and
of
what did
course,
he tell you?
yes, in Abuja, he'll show you his private lab where he's been doing certain things. I cannot vouch for anything. Corona. No known cure for AIDS, no known cure for certain diseases that he claimed he could cure. And that is what urged me for us to think that as journalists, we can only match such findings to science. So apart from that, in Nigeria, I also looked at a herbal medicine woman who came on, who is also a preacher, and said that he had cure for COVID-19. Also, some pastors also claimed they had cure for COVID-19. So in all this, the bottom line is, how do we test the efficacy of these drugs?
Right.
How do we measure it in times? And I must make it very clear that I'm a firm believer in traditional medicine. And I'm a firm believer of faith. But hey, this is about health. So in all these beliefs, we can only be cocksure of what we find out when we subject whatever we have to medical tests, especially against the backdrop that we know that these medicines that these cures that Dr. Abudu claimed he had, there's no known cure for it in any part of this world.
Right. Right. Indeed. Now, let's quickly talk about your report deeper now. Your findings are on the BBC Africa YouTube channel. But for the sake of someone who, for the sake of that person who is just listening right now and have no access to the internet, tell us what you discovered apart from those that you've mentioned in Nigeria. In Ghana, what did you find out?
So in Ghana, there's these two guys called the Abdallah brothers who were doing very, very brisk business. They came out on air to announce that they have a cure for corona, but they are not selling that product, knowing that gullible listeners who knew about this disease and the whole noise about it would definitely troop to them to go and ask for this cure. So Nicodemously, they were selling these products to people, despite a disclaimer on public TV that they don't sell these products. So the Abdallah brothers were featured prominently in film, where I go to them. They sell me some of this, one at the cost of nearly $200, and then they also throw big names of people having come from Italy to take the medication, and they said in 30 minutes you are going to be very good and you are going to be fine.
Wow.
Nothing is going to happen to you. One other place that I looked at was Quacks. Quacks is a food supplement. It's registered as a food supplement.
Okay.
They also are very categorical on their website that they don't have any cure for corona. However, behind the screens, when I went to purchase, they sold it to me not just as a corona cure, but also gave me a prescription of the dosage I have to take.
Oh, wow.
In order to cure off the corona. All this dovetailed into one thing. At the end of the day, all the noise that the Abdallah brothers were making, they take me to their manufacture plant where you see many of these being produced, many people being interested, and then they sell me worth $25,000, $100 which worth $25,000. So we are not talking about just fleecing the poor. We are talking about fleecing them and fleecing them well.
An industry.
So they were making some very good money. You understand? Against the backdrop of we have poor people, we have uneducated people whose only belief in medicine are this kind of people.
Right.
And at this time of the day, they chose to fleece these people off. So I take these samples,
Right.
and in their film, you see me saying that I don't know what they are. I take it to the Ghana Standard Authority.
Okay.
Now, the Ghana Standard Authority of Ghana is ISO certified, one of the best in the world. So I subject these medicines that are found to a critical scrutiny under the microscope.
Right.
And it's found that the drug that Dr. Abdallah and co are selling have poisonous substances.
Oh my.
And that it has a substance called phosphine. It has mold, it has yeast, and in fact, it's not fit for human consumption. I also take Core FX, and I realized that it also had high levels of mold, and it also had phosphine, which also makes it unfit for human consumption.
Right.
So basically, are the details in the film. But the other interesting bit is the fact that he says that the president of what's the country? Senegal.
Okay.
The vice president of Senegal had invited him to come and cure him. And when you research, you realize that you realize that people will peddle anything just to make money in this state that we are. So, sorry, it's a product of the pandemic.
Right. How long did it take you to put this story together? How long did it take you?
Not very long time, because as soon as the lockdown started, then we started thinking, okay, so what else can we find? So it's not very, and I repeat, this is the first film in the world, in the entire world, that is looking at the other side of Corona.
Yeah.
We've all been fixated with how to get back on our feet, how to get back to the world, how to find a cure. Nobody is looking at those people who take advantage. And I'm quite happy that yesterday, when the story broke, my other colleagues from South Africa, from Nigeria, from Cote d'Ivoire, from Congo, and other African countries have called me to say, look, maybe we should have been looking. There are other quacks here as well. So maybe this is a clarion call for my colleagues. Let's weed out these quack people.
That brings me to my next question, Anas. I mean, it's a very beautiful report, but there is a problem. The problem is that the Quacks are not reducing, and this underscores the impact of government regulation in what Africans, especially Africans, what we use, what we take in the name of medication. You have done the right thing. You took the samples to the appropriate authorities, but like you have said, you came to Nigeria here. These people have claimed to have cure for COVID-19, and it doesn't seem like everybody is monitoring them. What does that say to you about governments in Africa protecting or prioritizing the health of the citizens of the continent?
Well, I think that when it comes to health, it's not just government. We all ought to be alert, because when you buy this drug, you take into your body, it affects you as an individual.
Right.
Yes, regulators have underperformed generally in Africa because, one, the vast size of land, the population, under-resourced, and all those. But I think that, yes, in as much as we blame regulators every day, the onus should also lie on us to be able, especially the educated ones, to write such reports, because there are some people who don't read until they see some of these reports. They think that whatever they see these people saying on television are good. So yes, we have very relaxed regulatory regime across the African continent. But let's not forget, see, when you take quacks or quack or cures, you watch the film, you see a doctor moaning about how somebody died over malaria, taking false medication.
Right.
It's all across the country. And over 30,000 people die every year as a result of this. So it's not, and it's killed even more than what Corona has killed on the African continent.
Right.
So it's not a tea party. It's something that we don't have to just leave it in the hands of a regulator. The onus will lie on us, because the regulator can only feed on getting information. I know well that there are some regulators who won't act in spite of the information that they come across. But
Right.
our job as journalists is to put this information across to this our citizens to understand, so that whether the regulator acts or not, we will be forewarned, so that we can boycott these products, and then we can have a safer society.
Anas, you know what? Let's bring in our third discussant, which is, of course, the people listening and watching us right now. We will open up our portals for people to call in. And if you are watching online on YouTube, Nigeria Info 99.3 live on YouTube, feel I will be taking your comment any moment now. If you are on, Facebook, comments are already tripping on Facebook. So we'll be taking those comments in a moment. But for those who might be willing to calling, the number is, of course, hasn't changed. 0700 993 993 993. That is 0700 993 993 993. WHO. Hundreds of thousands die every year. And Anna's documentary has only focused on COVID-19 because there are a lot of people, heartless people, if you like, that are cashing in on the desperation of, the citizenry towards getting cure for whatever issues that they're dealing with health-wise. And we want to know this morning, the question I want to ask you this morning, if you are one of such people that you're claiming that you found the cure for COVID. If you're listening right now and you feel that I found the cure for COVID, please call me up. I would like to talk to you. 0700 993 993 993. And have you ever been a victim of fake drug use? Have you ever bought a fake drug before? I'd like also to talk to you. You can call that same line. Let's go to the phone lines very quickly right now and speak with Williams. Williams is calling us from Egbeda. Hi, Williams. Good morning to you.
Good morning. It's a very nice topic you guys are discussing there. But I'm just wondering, nobody ever talks about how this pandemic came into the world. I just don't understand. There's no cure, there's no cure. How did this thing come into the world? Nobody cares to know about it. So I just want to have a feel. How? And what could be done to penalize those who brought this evil upon humanity? That's just...
Oh, Williams, thank you for sending in, for calling. Appreciate it. Yeah, what we do know is that the virus started from Wuhan in China. That is what we know at a wet market in Wuhan, China. That is what I can tell you. It doesn't mean that it was created by anybody. Yeah, viruses are diseases generally. They are really not created by anybody. Just this morning or yesterday, it was discovered that there is actually another strain of flu that can be quite devastating, also found in a pig in China. So it doesn't mean that anybody is creating anything. Diseases happen. These things happen, all right? Let's remove our mind from the fact that everything that happens is always targeted at humans deliberately by some people. Adegoke is in Lekki. Adegoke, good morning to you.
Good morning, sir.
Good morning to you.
Yes, sir. Good morning to your guests. I have two questions.
Yeah.
Okay. First of all, in your investigations, throughout your investigations, have you also discovered maybe there's a reality of those who actually have the cure for this coronavirus, apart from investigating those who don't have the cure, the quacks? You get? Then secondly, my question is, are you also investigating the reality of the numbers of that we have been given that have coronavirus in Nigeria or in Ghana or anywhere in Africa, whether it's actually true, whether the numbers are actually inflated or it's a reality? Thank you.
Thank you, Adegoke, for calling. Anna, did you hear the question? Or the question?
Yes, I got it. So, whilst looking at this, the FDA here had, because you see, it was in our interest to find a cure, and I believe that the FDA is still interested in finding that cure. So I know that herbalists and co have been encouraged across board to try and bring together whatever drug they have that can help cure. The only thing they are calling for is that you cannot declare that cure in your bedroom. Bring it, let's test it, and let's make it available to the world. So yes, I found people who said they had cures. I also know of people who have queued to get what do we call it? To get their product tested and to be certified by the FDA as such. So yes, indeed, I met some, and I know those people have indeed taken their product to the FDA for tests. I also know that there are some herbal medications that have been taken to the Nigerian Standard Authority and then the FDA of Nigeria also for checking. What I don't know is what the results will be, because I'm not the regulator.
Right. He spoke about the numbers as well, the confirmed cases, whether you investigated. I know the focus of your investigation was to talk about those that are claiming to find cure. Let's quickly speak.
I didn't get your question.
So he asked another question as to the veracity of the numbers that are being churned out as confirmed cases. He seems to have doubts as to how we can truly say that these numbers are correct in the number of confirmed cases that countries announce daily. He was asking if you investigated that.
There's been a lot of conspiracy theories about numbers being either dropped or being made much higher. It's good to investigate this and to find out. But as I speak, I haven't looked into numbers, whether they are true or like I said, we've all been concerned about survival. Your basic instinct, government will want to play around with figures. My position will let it persevere. Let us know if it is 10. Let us know. Do not say it's 50. If it's 10, don't say it's 8. Whatever it is when we are informed that we know washing our hands and all that very serious.
Right. Let's speak with Joe Baba. He's calling from Alagbado. Hi, Joe Baba. Good morning to you.
Yeah, sure. Good morning.
Good morning.
Thank you very much. Honestly speaking, it's a big opportunity for me to speak with Anas. I mean, from we that love sports, I know what Anas does, on his reportage.
We'll come to that.
Yes, I understand. But my questions are, yes, he has done his findings, especially Ghana and Nigeria and some other neighboring African countries. But does that mean there is no cure, even when he himself has alluded that he believes so much in traditional, medicine as the case may be? Does that mean that any traditional being in Ghana, in Nigeria, in Madagascar, in Burundi, that the government in each country can give that chance, take them to the laboratories, even like he said, one has failed that after his report, he discovered that it was not good for consumption. But does that mean there's any other traditional that can be given this chance? Because in Nigeria, there are one or two traditional doctors that are claiming they have it here, they have it there. So can't the African leaders give them such chances? Why must we be waiting for the WHO every day for how many months now, and there is no cure? We can't continue to do that. And the second question is, the lockdown that we are experiencing in Nigeria here, the movement of people and how people have been surviving, is it how it's been happening in Ghana too? Thank you very much, sir.
Right, thank you. Anas, would you like to go ahead and answer those questions?
Yeah, but it's unfortunate that the voice is muffled, so I don't hear. If you could repeat the question to me.
Yeah, let's start with the second one. He said that is there lockdown in Ghana?
Say that again.
He was asking if you have lockdown, if you're experiencing lockdown in Ghana.
Yes, we did have our own share of it. We got the lockdown, but in the lockdown, as journalists, we were given passes to be able to work. So, yes, there was a lockdown in Ghana. Yeah, there was.
Right. Anas, please stay on the line. In case you are just joining us, you're welcome. It's a morning crossfire. And this morning, we're taking a look at a report done by Aremeyaw Anas of BBC Africa Eye. He joins us via Skype this morning to talk about how Quacks have been fleecing people, have been defrauding people in the name of finding cure for COVID-19. You can find this report online on BBC Africa BBC Africa YouTube channel. By the way, you can go there and just watch this report. It's an eye opener, and as even interviewed two Nigerians who have claimed that they found cure for COVID-19, and they were so sure that they found cure for COVID-19, but we haven't heard anything about them or whether the authorities are investigating whatever claim that these people are putting out there. So Anas is still with us. Let's go to break. After the break, we'll bring you the news at 8 o'clock. And then when we're done with the news, we'll be back here with Anas to continue with our conversation. Next step would be the citizens' involvement in unmasking. And that's not you. You're always unmasked. In unmasking those behind fake drugs, especially during this COVID time. Anas has done his job. Journalists are doing what they can do. But what is citizens' role in protecting ourselves? Because health, they say, is wealth. We're back in a moment. It's the Morning Crossfire on 99.3 Nigeria Info. Do stay here.
In an ever-changing world, one station stays faithful, giving you the very best in talk. Matters that affect you. Urgent, topical, timely.
Your number one station for talk.
We are reliable. 99.3 Nigeria Info. Let's talk. It's 8 o'clock. The news update on 99.3 Nigeria Info.
Travel between Nigeria states will now be allowed from tomorrow. It's one of the decisions taken by the presidency as it starts the relaxation of the nationwide lockdown in place. The chairman of the Presidential Task Force on COVID-19, Boss Mustafa, announced the relaxation on Monday.
The following measures shall either remain in place or come into effect. 1, maintaining the current phase of the national response for another 4 weeks, in line with modifications to be expatiated upon by the national coordinator. Permission of movement across state borders only outside coffee hours with effect from 1st July 2020. 3, enforcement of laws around non-pharmaceutical intervention by states, in particular, the use of face masks in public places.
The presidency has also approved the reopening of schools, but only final year students in primary, junior secondary, and senior secondary schools will be allowed back into classrooms. This is to enable them prepare for transition exams.
We are not talking about everybody going back to school. It's only the graduating classes in the primary level, primary 6. If you don't do something about them, they can't transit to the secondary school level. So they will lose a year. The same thing with JS3. If you don't do anything, because they can only qualify to move if they pass a certain examination. The same thing with SS3. There's a certain examination that qualifies you to go into the university. That's why, in addition to JAM or whatever other qualifications you have.
Nigeria has been excluded from the list of countries whose travelers can enter Europe when the borders reopened on Wednesday. The European Union Commission on SchengenVisa.com released a list of 54 countries that qualified for travels into Europe. It says citizens of Brazil, Qatar, and the US, Russia, would only enter Europe when situations in their countries improve. You can follow us on Twitter at Nigeria Info FM for more. You can also like our Instagram page, Nigeria Info FM Lagos, for more interesting headlines. And on Facebook, we're there, Nigeria Info 99.3. I'm Sheriff Quadry. Let's get back to the morning crossfire to continue with our conversation on Corona Quacks. Stay here.
We keep you informed all day long with the best radio programming. From the morning crossfire with Sheriff to What's Up Lagos with Collins, Teka.
On What's Up Lagos, let's go straight to the next story.
And at noon, it's the sunny side with Joyce.
Sunny side with Joyce.
Let's talk hard facts with Sandra
I will
Ezekwesili.
present a story the way that it was presented.
Femi and the gang bring the game on with day-by-day accounts of magnificent moments in the world of football. And we also keep it live and dangerous with Daddy Freeze. And finally, the chat station. All for your listening pleasure. Your number one station for talk. 99.3 Nigeria Info. Let's talk. This is Morning Crossfire on 99.3 Nigeria Info.
Absolutely. This is Morning Crossfire 99.3 Nigeria Info. And this morning we are looking at a BBC Africa Eye report done by Aremeyaw and us on, well, it's titled Corona Quacks. This basically just centers on individuals that have claimed that they have cure for COVID-19, fleecing unsuspecting citizens on the continent of their hard-earned money and their good wealth. Yeah, well, it depends on where you look at it from. That is our conversation this morning on the show, and Anas joins us via Skype this morning. You can watch us live right now and see Anas, like not CC, you know, in his usual mask. You can see him right now on Facebook and YouTube. Nigeria Info 99.3. Go search for it. Nigeria Info 99.3. I'll be taking your comments on YouTube and Facebook any moment now, okay? Keep dropping your comments. Platforms, we got quite a handful of them already on YouTube and Facebook. Feel free to also send me your thoughts via WhatsApp as well. You can call the studio. The WhatsApp number is 0809 597 5805. That is 0809 597 5805 on WhatsApp. And the studio line, particularly here, is 0700 993 993 993. Again, 0700 993 993 993. Anas, thank you for remaining with us on the Crossfire this morning.
Sure.
Let's take some feedback very quickly before we go to the phone lines. Let's start with WhatsApp. Olakunle on WhatsApp wants me to ask you this question. Whether you've looked into reports of so-called FDAs and even the WHO on their findings about possible cures submitted to them. And he wants to know whether you've been able to find out how many has been struck out and how many are still being tested. He also wants to know what does you have to say about the Madagascar cure and the country's reaction to WHO's handling of the virus. Let's start with the Madagascar cure. Madagascar's government sent some samples of that Madagascar herbal drink to Nigeria. Were some samples sent to Ghana as well?
Well, if I heard you right, your question was about the Madagascar cure, what I know about it. Am I right?
Right.
For you, I lost you.
Oh, apologies for that.
Yes. So, yeah, I can only comment on what I know and the investigation that I did. I heard that there was a cure for Madagascar, and I know that our regulator said that, yes, there could be a cure, but if it should come into Ghana, we are going to subject it to a test to see whether it meets the scientific evidence.
Okay.
I have not personally checked what Madagascar has, but I can only talk as a citizen of Ghana that I'm allowed and the product is put into my country only when the regulator has properly tested it and then is sure that it can work for us. I don't know. Some people, I've heard testimonies of people saying that it works. I've heard testimonies of people also doubting it. Whatever it is, I think that it's science. that at the end of the day must triumph in all this, what I would say, controversy. Before you go out, let me add that this film you are watching or you've just seen is just part one of the films coming.
Okay.
There will be a part two, focus on the corona thievery. That whilst all these things were going on, the countries were under the lockdown and food was provided to the poor. Some people who were responsible to ensure that these poor people get this food to eat also were selling it during the lockdown. This is what you see in part two of the film. You would also probably see a hospital that is selling PPEs, personal protection equipment, to us when we all know that frontline staff need these things to survive. We will see in the part two coming in a few weeks. Stay glued to BBC Africa Eye, and then you see all this.
Fantastic. Now, let's wrap off looking at you and your journey in the investigative field of journalism. How has it been, Anas? What would you say was the toughest investigative report that you've ever done?
It's been turbulence. I mean, and investigative reporting or undercover reporting is not a tea party. It's supposed to be something that is that will mysteries, and you come into contact with bad guys. They want to hurt you. I'm sure the last 2 years you heard of the death of my colleague Ahmed Swali.
Yes.
Who was shot twice in his heart and once in his neck. It tells you the problems we go through as an or investigative report. And this, I don't limit it to only myself here. There are Nigerian journalists who are facing similar problems. There are Nigerian journalists who have died. There are South African journalists who have died. So the path would always be rough. But we must have the tenacity, the spirit, the strength to be able to fight whatever comes. Because whereas government keep going and changing, what will not change is the voice of the people. Right. What will not change is civil society. No matter how difficult it is to be, we have to keep pushing the frontiers of our democracy. Thank you very much for this interview.
Well, before you thank us, finally, we'll thank you again. But I want you to hit the nail on the head as to that one report that you did that you found quite challenging. That one report that you found quite challenging.
Well, I think it's difficult to point out when you look at my football story, which was on the African World Cup, many people going down the drain, FIFA top bosses falling, Confederation of African Football people falling. When you look at my judges scandal, 34 judges, over 160 staff going down, and you look at the stories I've done, which has led to prosecution, people being in jail and all that. Right. It's actually very difficult to point out, but the best is yet to come. Thank you very much.
Let's have you address those that are willing to follow in your footstep right now to being an undercover journalist. What would you advise them?
Well, I think they should focus. I mean, the threats and intimidation will come. Let's not forget that posterity will not forgive us if we don't stand to fight. Because before us, there were journalists who sacrificed, journalists who pushed the frontiers of our democracy. I'm able to speak to you freely today because somebody made it possible. Right. Somebody made it possible for you to have a radio station. Right. Let's not disgrace this. The difficulties will be there. The politicians will take advantage. The thieves will take advantage. The businessmen will take advantage. But the day we give up, society will be in chaos.
So for them, they should persevere and they should focus.
Lost you?
Yeah, I said for the burden undercover journalists or investigative journalists listening to us right now, you're saying to them that they should remain focused and, perseverance. They should have that at the back of their mind.
Yes, young journalists should learn that it's not going to be easy, but if they believe in the truth and they focus and persevere and they eschew dishonesty, definitely they are going to make it. People will call you names. It's normal. This is if you're doing this job and people don't call you names and people don't try to kill you, it means you are not being effective. But that should not dampen our spirit. It should rather motivate us to fight and fight harder.
Fantastic. Anas, thank you so much for joining us this morning on the Morning Crossfire all the way from Ghana. Always a pleasure.
Thank you. Nice talking.
It's a pleasure from our end as well. There you go, Lagos. Anas Aremeyaw. Anas joining us all the way from Ghana this morning to talk about the latest report put out by BBC Africa Eye, talking about COVID-19 and those people, some people claiming to have a cure for COVID-19. Now, let's continue our own talk. Anas has done his job. You can go to BBC Africa YouTube channel and watch that report. It's an interesting report. It's an interesting report. You need to go and check out that video on YouTube. That's BBC Africa Eye YouTube channel for you to have a better understanding, even more deeper understanding as regards what Anas put out and what BBC has done in the fight against COVID Quacks. That's right. So I want to ask a question this morning while we delve into our own personal conversation this morning. It's been touted over and over and over again as to the need to look for indigenous cure for COVID-19. Would you say that we've done enough to say that we're looking for indigenous cure for COVID-19? Yes, even Nigerian scientists are currently working on vaccine as we speak today. Nigerian scientists are working from Adeleke University. They're working day and night to make sure that we have our own vaccine tailored towards the black and, the black-skinned people. Yeah, they're working on that. But my question is, looking for vaccine is different from cure. Let's not mix it. So looking for cure, have we done enough in our own space to say that, yes, we have tried to look for a cure for COVID-19? That is our conversation this morning. I mean, you can see the race to finding a cure, what it has led us to, that point that it has led us to, where people have been claiming that they've found cure. And this is how we approach virtually everything. I mean, if you're a lover of herbs, you know that once somebody just gives you one black something or green or red or whatever color, I mean, herbs they come in different colors, actually. So whatever color they give you, as long as you know that it's herbs, people don't want to ask questions. We don't just care. We can't care because, according to us, we are herbal people. We are traditional people. We love herbs. So in the name of finding cure, we are very quick to embrace herbalists who have come out to say that, listen, we have found a cure. Now, as a people, as a government, have we both done enough towards ensuring that we find a lasting, long, effective cure for COVID-19? You as citizens, you have your role to play. There is no doubt about it. And that was what Anna said earlier on when I was talking to him about the role everybody has to play. The government, the regulatory agencies, even the people. By giving information to the right authorities. That is one of the roles that you have to play. Have you done that role effectively? Because it seems to me, if you ask me in Nigeria here, we're fond of just saying, look at them, what they're doing into, and that's where it ends. That's where it starts and that's where it ends. Nobody makes any effort to, well, very few people do that, to go the extra mile towards making sure that whatever that person or those people are doing doesn't come back to haunt us, doesn't come back to hurt us, doesn't come back to cost us. So we just complain and we let it go. That's on the one hand. Our focus is, have we done enough towards finding a cure for COVID? Journalists, reporters, NGOs, CSOs, government regulatory agencies, they're doing their part. But are they doing enough? I hope I'm very clear. They're doing it. Even some citizens are doing their part as well. But are we doing enough towards finding a cure for COVID? 0700 993 993 993. Please turn off your radio when you're calling in. It'll be highly, highly appreciated. You can join the conversation on YouTube and Facebook as well, because we're streaming live right now on those portals. Feel free to join the conversation there. The WhatsApp line is also up and active. The WhatsApp number is 0809 597 5805. Let's speak with Chooks. Chooks is in the Keja. Hi, Chooks. Good morning to you.
Good morning, Sheriff.
Good morning.
I actually want to commend Anas for the good job. I mean, I was calling to speak with him. He has been somebody I really wanted to speak with all along. But he actually did a good job, and I actually commend him. But this is actually what I've been saying all along, because we here in Nigeria, 75% of our journalists here are just about the numbers. Okay, yes, the NCDC has released these particular numbers. Yes, so what is really happening? How can we get cure? And all these things are the things that we really need to be looking at. And as a people, personally, let me speak myself. Personally,
right.
I think I've seen a couple of persons. In fact, some persons have even, because when I was inquiring from people, some people have directed me to somewhere at Ilaje, after Aja.
Okay.
That, they've gone there, they've even gave me address and all that.
Oh my!
So I was like, okay, fine.
For COVID-19 cure, Chooks?
Yes, for COVID-19. Yes, somebody gave me address that was where he went to and got cure for COVID-19.
Oh my word!
Is after is Ilaje Sharp. If you're coming from Lekki, Ilaje is, you know Ilaje now.
I know Ilaje very well.
Yeah, so that's he gave me the address, and it's not only him, a couple of friends, because we were together that day. Some people also said yes, they've also heard some people talk about that particular place and all that.
Oh my word.
Then I was like, okay, fine. If this place is actually, if the cure is actually real, why have the government not gone there and okay, bring your drugs, let us use it? And what I heard was that they've actually they actually came out, but government wanted to close it down. So they are not doing it illegally. They are not doing it, okay, if you know, come inside, like come within, let us give you the treatment and all that.
Wow.
So if these people are really operating, and if they are, I don't know if the drugs are genuine or not.
Of course, you don't know. You are not a scientist, of course.
What I'm saying is we should dig out these things. If they are real, let us encourage them. And if they are not real, let them be punished. That's just my case. Anyway.
I totally agree with you, Chooks. I mean, yeah, you've done your part, by querying what you're supposed to query. The part that I don't get is that if these people are operating and people know them, the story that you heard, Chooks is gone. The story that you heard and the stories that people are being peddling around about these people. How are we sure that that story is real? That because they came out, they now wanted to shut them down. I doubt that story. I doubt it wholeheartedly. Because right now, it's for the glory of everybody. Not just the people alone. It's for the glory of the country. If a cure can be found here in Nigeria, oh, goodness me. You have no idea what that would do to our local economy. It's a race, like I said earlier. It's a race. Countries world over, everybody is running to be the first to find a cure. It's just the same way that they are running to find a vaccine, a standard vaccine for COVID. It's the same way that they are running to find a cure for it. Benjamin is joining us from Victoria Island. Benjamin, good morning to you.
Good morning, my brother. How was your night?
It was short, but okay.
Thank you. Thank you for a good conversation this morning. See, let me just start with where the last caller stopped. You see, our people doesn't take our own distance here serious. They always prefer the outside owner where they will get a lot of money. We have been listening to some people they have interviewed, Maurice Iwu, the Oba of Ife or something like that came out on air that they have the cure. And what the NDDC and all the health minister keep on telling us, they should follow the procedure. We don't know for how long they will follow the procedure.
Yeah.
There are some people today, traditionally, they have something that can equivalent that can cure such a thing. And some people say that we use a human being to test. If our people are serious for all these kind of things that are coming up, they will follow them up and test them. Some people say they will use their life or something like that to test on their own. That's one I listened to one of the media that come up and use that he can go to any use his son or his daughter to test. That they have the cure, but our people cannot follow it. Why? They will not get from there. They keep on directing them, follow the procedure, follow the procedure. There are some people today that doesn't have 1 million, 2 million.
But there is a procedure, Benjamin. There is a procedure to be followed.
I quite agree with you.
Exactly.
Why can't they fast track? Why can't they fast track those our people for that procedure? Why can't they follow them up? And so far they have this is. Why can't they follow? Why can't the people appropriate water that they are in charge to follow those who are people that has it? What happened to the Madagascar? This thing they brought today.
I am not speaking for them. I mean, I'm not speaking for whoever that is doing it, the regulatory agencies. But I can tell you that nobody is sitting down folding their hands. It's a global pandemic. Everybody.
My question is this: for how long can we be waiting to get the cure?
For as long as it takes. So here is the thing. If you listen to Sandra's show the other time, she explained the timeline it takes to put out a vaccine. It's the same when you're trying to look for a cure. It's the same when you're pregnant. You cannot jump one step without completing it. You have to carry the belly for 9 months. It's the same way for medicine as well. That is why from the beginning it's being said that, look, forget about vaccine or cure for now. Anything that will come in 2021. You remember that? Because it's fixated. It's like that. You can't jump it. So anybody coming out, that's why the doubt is always the first when someone comes out to say that I have a cure. Yeah, that cure must be subjected to series of tests. Just to make sure that it's safe for you. Just to make sure that it's safe for me. You never know who will take these drugs. Haven't you heard of fake drugs before? As little, as small, well, it depends on how you look at it, as paracetamol. We were in this country when Dora Akunyili of blessed memory, waged an all-out war against fake drugs. Is this one that you think that they will now not put out fake drugs? I mean, this one, Corona. When fake drugs have been in our markets for years and nobody was paying attention to them. So you see, it's important. The process is there for a reason. And I think we should allow the process, run its course before we can say, okay, now we have a cure. Let's go to break. We'll be right back after this. Stay here on Nigeria Info 99.3.
You are listening to your number one station for talk.
99.3 Nigeria Info.
99.3 Nigeria Info. Let's talk.
Radio like you've never known.
What's up, Lagos?
What's up, Lagos?
What's up, Lagos?
Radio for everyday people.
This is Samuel Moses from Lekki.
My name is Jimmy from Orita in Ikorodu.
Jimmy from Abidjan.
This is Moses calling from Ikeja.
The feel of Lagos from the mainland to the island.
Your first paycheck.
Yeah.
What did you do with it?
I gave it to my mother. Yeah.
My first paycheck was 150 naira.
What's up, Lagos?
Hi, my name is Collins Deke. Join me every weekday from 9 to 12 on What's Up Lagos? Yes, you heard me right. It's good radio for beautiful people. 99.3 Nigeria Info.
I love your program, Collins.
Collins, you are doing good.
It's What's Up Lagos, baby. Get set.
We can no longer continue like this. The government said we should be indoor. They should also allow the food sellers and others to sell for us.
They will die of hunger before the coronavirus. Please, the federal government should please come to the aid of the common men.
Perspectives, a news and current affairs program which attempts to find a common narrative or maybe several plots tying Nigeria's major cities.
Tell this government, they help these people.
The fuel too cost for us. They buy fuel 300 and a per liter.
Every week, our team of correspondents delve into the heart of the story behind the scenes. Right here on 99.3 Nigeria Info. Let's talk.
99.3 Nigeria Info, your number one station for talk.
Let's talk. This is Morning Crossfire on 99.3 Nigeria Info.
99.3 Nigeria Info. Yes, we're talking about finding cure for corona. an offshoot from our earlier discussion with Aremeyaw, the renowned investigative journalist from BBC Africa Eye, who spoke to us about his report that he did on Corona Quacks. That report is on BBC Africa YouTube channel. You can go watch that report there. It broke yesterday, and Anna's joined us today. Amazing stuff. And yes, I'm asking the question off of that conversation. Like, have we done enough as a people to find our own cure for COVID? And yes, conversation, has gone into a very interesting direction. Samson from Ajay is here. I'm looking at Samson's message and it makes me laugh. Samson says, don't doubt the guy's theory. In this country, especially when it comes to health matters, once it is not scientific, it is not real. And our brainwashed leaders will fight you with all their strength to kill all local efforts. That's something. So something, it's actually not true. I swear it's not true. Because I remember very well that back in the day, all these tradomedical guys, back in the day, their drugs used to be in the raw form trado. Then NAFDAC came and there was some kind of revolution, and these guys, with all the respect in the world to them, forget that I'm calling them guys, because they actually know what they're doing. They started transforming their, herbal medicines into capsules, into tablets, and everything. So I'm trying to explain to you that it's not true that if it's not science, then it's nothing. No, it's not true. We have actually done well. I can speak for Lagos State government. Yeah, because I've done so many reports in that area. We have done well in encouraging herbal products, herbal medicine in Lagos here. Yeah, so it's really not true. It's a misconception that I wish that you could just throw away. Emmanuel says the only problem we have in this country is that we don't believe in our local content. If our people say that they have discovered the cure, why can't we test on it and see out? Okay, in fact, it seems we are confused in this country. So let me at this juncture, let me say that we will try and get NAFDAC here. We've been after NAFDAC for weeks now, if not months, to get them to come on the show. So it's not always easy to get them, actually. But we are doing our best. We're waiting on them to give us a date. They have our invitation already. So as soon as we get the date to have Professor Moji Adeyeye here, we'll get her on the show and she will talk to you as regards updates on what NAFDAC is doing as concerning the local samples from local kiosks that they're currently looking into. All right. Quickly, let's move on to another message from WhatsApp. It's a long one. Chukudi has a lot to say. Chukudi says the most populous black nation in the world has not shown the world any product of rigorous thoughts, experimentation, and contribution to knowledge in this crisis. What the world has seen is the PTF on COVID-19. What Nigerians have not seen is a government think tank or group of core scientists and input of eggheads from community of researchers. We have not seen real knowledge on the cusp and indigenous potential solutions either being proposed or proposing itself for salvation of humanity from the glimmer of the hope for the black race Nigeria. Chikudi Rapa sent that message in this morning. Whoever you are, I'm going to block you. Somebody is sending me some nonsense message. I'm going to block you on WhatsApp if I receive that message again. Yeah, so let's get to the phone lines and take more thoughts in. I have some messages coming through from Twitter though. Maybe we should do Twitter, right? Yeah, the phone line guys can't wait. Someone has been waiting on the phone line. Let's hope that he's here. Ezekiel joins us from Apapa. Hi, Ezekiel. Good morning to you.
Yeah, good morning, Colin.
Thank you for waiting.
Sherry, Colin, sorry.
Yeah.
See, this fight on COVID-19, this is the problem I have about this whole thing on submitting concussions and co. When Sandra analyzed, I think last week on the one of the Adeleke University, which is also on the line of vaccine. Now they passed phase 1, and they are also on the line with some other people. They are past phase 1 on the trial.
Right.
So you that is coming, you can't say simply because people are dying, you don't want to follow the due process on this. It's not done like that. See, that is the major problem we are having with this Madagascar, whatever.
Right.
That was parading himself on Madagascar.
Right.
I don't understand. It doesn't work like that. You can't say simply because people are dying. I heard somebody say that for how long will this take? And we don't want to give our people time. It doesn't work that way. For instance, when the smallpox that started, I think in 1980, before it was finally eradicated,
right,
it was about 1970.
Took years.
Yeah, so that is, anything virus and any vaccine usually takes time. At times even 3, 4, 5 years.
Right.
Before a concrete vaccine, before a certifying one will come out.
True.
That people we can vow for.
Very true.
So this thing just takes time, and for the time we'll be managing the virus with whatever method we have.
Right.
But for you to say that you have a cure when it's not proper, when it hasn't gone through a trial yet, it's really a mess, and it might end up doing more havoc than any good.
Thank you, Ezekiel. Appreciate your time. So there is always the need for drugs or would-be cures to go through clinical trials. It's a standard. That's where it happens anywhere in the world. So like Ezekiel said, we can't say because we're desperate and anybody comes through with some kind of mixture and we just take it hook, line, and sinker. It doesn't work that way. Ismail Olabayo Oladejo on Facebook says, Morning, Sherry. This is the reasons why I think something good may not come out of Africa. Because we are too greedy. We always look for personal gains instead of looking for something that make people all over the world to see Africa as one of the best continents in the world. Can't we just use this COVID-19 to redeem the image of Africa? Later now, they will be shouting Black Lives Matter. We always look for a way to extort each other. Africa, wake up from your slumber. Ismaila Olabayo Oladejo sent that in on Facebook. Olamide Michael on Facebook says, good morning, thank you for this, but why can't we put more energy in finding out those that can actually cure COVID? I think Africa needs to be more positive in this period. Instead of downplaying our abilities, there will always be quacks in every system. Thanks. Olumide, you're right. You're very true on that one. Ryan King says, good morning, Sheriff. Herbal medicine have been with us before the arrival of orthodox medicine. This is even part of what we consume in our daily meals. Why must we trust WHO clinical trials to authenticate these products? Because it's dangerous. Do you even know the person that is putting forward the herbal medicine? Do you know the history of this person? You can't just take any drug that comes out or any mixture that anybody, gives you. Can you place your life on the line to want to take anything that anybody brings out today and say this is the cure? No, we have to attach this seriousness, this huge seriousness, to lives, because we're talking about lives here. If anything goes wrong, that person is gone. Even common drugs that you take, if you take a drug wrongly, if it affects any of your organs, that's it. That's how delicate the situation is. We can't just say because herbal medicine has always been with us, we're trying to. No, it doesn't work that way. No, it doesn't at all. Emmanuel Ame on Facebook says, it's a shame humans can go at any length to make money and the authority will not take appropriate action to bring them to book. Thank you for your message. Let's go to the phone lines once again. We'll go to WhatsApp in a moment. Hello, good morning to you.
A very good morning to you, Sheriff.
Good morning. Please turn off your radio.
I'm trying to do that.
All right.
Okay, are you okay now?
Yes. No, it's still up.
It's off. It's off now.
It's better now.
Okay. some weeks ago or a month now,
Right.
the NASA said they were this three type of drug. Hello?
We're with you.
Hello?
We're listening to you.
Are you with me?
Yes, we're listening to you.
Okay. The NASA said they were three different type of drug. They were testing it, whether it is positive for this COVID.
Right.
Have they given out the result?
None that I know of, but these things take time.
I think they have the equipment to tell whether it's effective or not effective. We are expecting that. And again, yesterday,
right?
Because when we talk of scientists, yes, I believe in them. But somebody said something yesterday. That is the pastor of Winner. Do you hear what he said yesterday?
What did he say?
He said they have more than 100 people killed by the church.
Yeah.
Can't they fight this man? Because we are preferred solution right now.
Okay.
Maybe what he said is did he use prayer alone, or did he have drug that he used? Let the authority call him.
He said prayers. He said prayers that they've been healed through. Yeah, he said prayers.
If the NDDC or what they call that
yeah. And NCDC,
yeah. Vote to be really affected by this virus, take about 10 to him. Let him cure. If he can perform that miracle and he cure them, I want Nigeria to just say kudos to him. But if he fail, it will just shut off forever. So nobody should just discard anybody. As he said openly on the page of newspaper yesterday, and Nigeria had it, I read it, you read it, everybody know about it. If I were the authority, I would just please come around, want you, come and perform that miracle up to 10 or 15%.
Right.
That's my stand, yo.
Thank you. Thank you, Vince Wise. Let's speak with Benga who's in Ikeja. Hi, Benga. Good morning to you. Benga, are you there?
Yeah, I'm here. Good morning.
Good morning to you.
All right. So I just want to quickly make an analogy.
Yes, please.
I've listened to you over time, and I understand that you're a positive person. You always want to see the positive side of things. But I would like to reiterate that we live in a very unique Nigerian system. I stay in a place where the road is really bad. I'm talking about Akute.
Okay.
Now, somebody brings his own money to do the road, but the king will tell you you have to submit so amount of money to so amount of person to do the road that you want to use your money to do. That's the kind of country we live in. So when somebody is telling you the government can shut down things when they don't make money of it, it is true. It has been proven over time. There are a lot of people that have goodwill, good insight, good knowledge, good intentions, but because the government has nothing to gain from it, it is highly possible that they want to shut it down. That is just my analogy.
Okay, Gwenga, I hear you loud and clear. I mean, yeah, I've heard situations whereby a particular company wanted to fix a road for this was in Port Harcourt, by the way. I'm not sure. I can't talk about Lagos because I haven't. A particular company, multinational company, wanted to fix a road for a community. And the community requested that that company gives them the money to do the road and also pay another money to the boys of the community for wanting to do the road for them. So, Gwenga, I totally know what you're talking about. Let's see who is here. Who's Edwin? Okay. Hi, Edwin. Good morning to you.
Good morning, Nigeria Info.
Good morning to you.
Yes. I think the situation we are facing now is one of the major criticisms that globalization is having. Because when it comes to issue that has to do with drug, or maybe things that has to do with giving some certain people accolades,
right? Right.
it will become an issue that every tentacle will be raising up. I want to tell you categorically, you are a journalist, not even talking for the whole Africa, even the whole Nigeria.
Right.
When we're talking about issue that has to do with health, I see it as just like our basic need that has to do with food. Our delicacies, the food we're eating in Nigeria here, or maybe if you have opportunity of traveling all over the African continent and you make friends with people,
Right.
you visit them and they serve you some delicacies, which is to them is very, very vital, or maybe is reserved for the kings. If you put it to such clinical trial, it will fail. And these people have been eating it, dining on it with kings for years, and it doesn't have issue with them. If you leave Nigeria here and the normal delicacy you are familiar with, and you go to Europe, where you find yourself with pastors and the rest of them, you don't need to say, okay, until you come back home and get what you want. You start using what you find yourself around there. But just because of globalization, that is the major issue we are having. I want to tell you that on this issue of COVID-19,
Right.
the reason why it is going wide like this is that just the power that want to produce this has not come out. Because within Africa here, within Nigeria here, I'm assuring you that we have the cure. Some of all these agbos that were parading around,
Right.
all the people that have claimed for the cure, you have said it this morning. And I want you also to make much effort. If you keep hyping on the ones that government has told us that they have told them to bring for trial.
Right.
If all the radio stations keep hyping on it on daily basis and make them popular, I'm sure the government will be forced to do something. So my own concern is that let us not wait. This is just purely globalization issue. Everybody know about it. Let us not wait until others bring, because even if they bring all the PPA now are using in the hospital, I want to tell you that no Nigerian pharmaceutical or maybe the agencies that regulate anything have submitted them to any clinical trial. If they bring any drug for us today, we will not even bother to say, okay, let us subject
No,
it
but
to
but
clinical
we're
trial.
actually manufacturing some PPEs, non-pharmaceutical PPEs, here in Nigeria. I know that.
Yes. I'm talking about the ones that possible
That were brought in.
find its way. Yes,
Okay.
find its way into the
Okay.
country.
All right.
Most of the time, we have so much 100% reliance on anything that comes from outside. And it's not our fault. We have been conditioned like that because of globalization. I'm a student of it, and I know that it's one of the major criticisms.
So we need
that
we need
globalization
we need to work harder. Is Edwin? What you're saying? We need to work harder as a people in promoting our indigenous products.
we need to work harder in promoting our indigenous products. And sometimes we don't even need to blow it out of proportion. Let's
Right.
just work. You know, my brother, you are there now making your money. Your younger brother or your senior brother may not even know your account value. It is not necessary all the time if we are looking for a solution that will cure our problem.
Right.
We put it in the front burner, telling the whole world, yes, we have gotten it. Let us solve our problem. When we say our people are not dying, I think other people will come to Nigeria and say, is it that this,
What are you people
this
doing?
virus is not affecting you people?
Right. I feel exactly what you're saying, Edwin, and it makes a lot of sense in promoting whatever it is that we have in Nigeria. The part that I want to a bit, I don't know. I'm not going to say that somebody is trying to pull down indigenous products. I'm not going to say that. What I do know is that whatever the government is doing, it's in our best interest. Like somebody said, I like to be positive, but that's the only thing I know how to do. Because look at it, it has to be in our best interest. Because without us, there won't be government in the first place. Do you understand where I'm going with this? Without us, there won't be government in the first place. So whatever they're doing, it's definitely in our own interest. It's definitely 100% in our, especially as it concerns this COVID-19, because it's a burden on them. It's a huge burden on their shoulders, and they can't wait to get rid of COVID, so they can do other things that they're supposed to do. There are things that I can't say, but that's the farthest I can go. It's a burden that they cannot wait to just continue with their normal lives after this. Let's take another call very quickly right now. Daniel joins us from Ikorodu. Hi, Daniel. Good morning to you.
Yeah, Sherry, good morning.
Good morning.
Yeah, lots of people calling, asking for, for this vaccine. That's the herbal drug and our neighboring country cure. What I'm here to say is that, see, this cure, the thing, is not something you should expect anytime soon.
True.
You shouldn't expect any cure anytime soon. This is not a joke issue case. Let's say the virus started from Wuhan in China. If you are expecting something anytime soon, even the China, okay, I'm sure China has more herbal stuff than we here in Nigeria.
Well,
China,
yes to that.
they can't find a cure. Then why are we expecting cure from Nigeria here? You understand? Though I agree that we have so many practitioners, those are good in it, but do we even trust them?
Right.
Are we sure that what they are bringing to the front?
Can we vouch for them? Can we say that, yeah, we can take these drugs, that any drug that comes from Nigeria, who will take it? Who will take it? Me, I don't.
Is it something we can, okay, fine, even if this drug, if this cure is available, can we make ourselves like available for testing? Is it something we can trust? So that is what I'll ask Nigerians to just be patient. We should be patient and take life very, very serious.
Right.
Not expect any cure anytime soon. It's not something we just expect. At least, please, Nigerians should be patient. That's just what I just have to say.
Thank you, Danny. I appreciate it. Let's go to Facebook. No, let's go to WhatsApp first. Then we'll go to Facebook. Sharif, take it or leave it. People have been dying before this COVID-19 comes there. Of course, I'll take it. COVID-19 is not killing anybody here in Nigeria. We're just wasting our time. Yes, it is. All these people that you see dying are those that have health issues that cannot be able to travel out of the country for treatment. That's not true. Okay, I think I'm done interpreting your message. Let me go and take another one. I think I've tried interpreting your message, by the way. So I'm just going to go and take another message right now. Okay. I'm trying to block somebody. The person kept sending me some messages that I don't want to see. Let's see. Who here? Good morning. For me, people saying that reopening of church and mosques can heal the country. Oh, okay. From the virus, I disagree with them. We can pray at home and God will heal us. Tokwe from VI sent that in. Tokwe, thank you for your message. I really appreciate it. Balogun Olatunde from Ikoton says, we are all told that we might have to live with the virus for now, just like HIV and so on by WHO. I see people dying of malaria every day, so why getting all wrong? I don't understand. Life has not been the same for people, and I feel that we can manage the situation. The way it looks in Nigeria now is like it's been politicized. Balogun sent that in. Balogun is in the cotton. Balogun, thank you for your message. I'm going to take another message very quickly. Nigerian government, na scam. Even if you're having the antidote for this virus, trust me, Nigerian government will find a way to perish it all in the name of corruption. Dami sent that in from Ijebu. Dami, thank you for your message. Appreciate it. Let's get back to the phone lines. It's 8:51. We're wrapping up on the show any moment now, but we can squeeze in a call or two. Hello, good morning to you.
Yes, Mr. Chuku from Ogun State.
Welcome, Chuku.
Your name, please. Turn off your radio set.
We lost Chuku there. Chuku, do try and call me back if you can. Appreciate it. Hello, good morning to you.
Hello, good morning.
Good morning.
Yeah, well done.
Thank you. Who am I speaking with?
My name is Andy.
Andy, welcome.
Yeah, I didn't want to say anything before, but when you said that everything that government is doing is for our best interest, that interested me, and I got my interest.
Okay.
And I want to disagree with you. Government is not doing everything for our best interest.
It's okay.
But for instance, the issue of, as laudable as it is, the issue of allowing private labs to conduct tests.
Okay.
At the cost of approximately between 40,000 to 52,000 naira. Is that in our best interest?
Some people
can afford 40,000 naira.
Andy, between me and you and the person listening right now, some people can afford it. They want to run a test, but they cannot because of the crowd. at the government-owned labs.
I agree with you. Yeah, I agree with you. Some people, yes, I like the word you use. Some people, the majority of the people, can they afford it?
But these people,
the point I'm
go on.
to make it very simple. It is government can subsidize if they are doing this thing for our best interest. They have gotten a lot of money for this COVID-19, both borrowed and donated money. Why can't they subsidize these private organizations to conduct tests?
All right.
Instead of, because 40,000 naira is beyond
Andy,
the minimum wage of Nigeria.
Andy.
So, hello.
Let me be honest with you. I'm not going to mince words. I think that, right, whatever it is about the private labs, they are private companies, and government cannot continue to subsidize everything, right? I know that it might sound very...
This is not everything, please.
You're saying they should subsidize it.
It's a pandemic. It's not everything.
So we're subsidizing power, we're subsidizing fuel.
That is not doing anything for us.
No.
In how many months government have done less than 30,000 tests?
No, that's not true. Not less than 30,000 tests. We've done over 100,000 tests actually.
Over 100,000 tests. How many tests does a patient get?
And I agree with you. I agree with you that we need to do more.
A patient does more than 4 tests.
So I agree with you that we do more. I agree totally. Now we are trying to do more, and yet you yourself that you're saying we should do more are the ones giving conditions why we should do more. Trust me.
There are making too much excuses for government.
No. We are making. You are making too much excuses for the people, because you are speaking on behalf of people that can afford to run a test and can't do the test because they have to wait on the government's labs to do this test. Do you understand? But if private labs, hold on. So let me answer that question. There will now be less crowd in the government-owned labs waiting to run a test.
You know how Nigeria runs. The government people will still take advantage of the government facility and direct it to themselves. They will not.
If you don't have a reason to run tests, what are you directing to yourself? If there is no reason to run a test, what are you directing?
How it is. Look at tests, for instance. Government institutions like government unit schools in Nigeria. Does it get to the best students? Who can get there?
No. Again, that is wrong now, Andy. I have friends who didn't know anybody. Yes. 100% yes. It is not a lie.
I know. People do not get admission.
That is not true.
By how much you pay.
That is not true. People getting by merit. Andy, it's been fun talking to you. We have to go right now. It's 8:55. Oh, Chuku.
Hello, Mr. Sheriff. Good morning.
Good morning to you.
Please, Mr. Sheriff, I've been here for over 4
I am
minutes
sorry.
now.
That's why I picked your call. I'm really sorry.
No problem. Please,
I'm really sorry.
Can you give me an opportunity to
yes,
play the
please.
1 minute?
Please, yes.
Yes. Can I play the 1 minute?
Yes, please.
All right. I'm ready.
Oh, you mean just a minute? No.
Yeah, just a minute,
No. I'm really sorry. I mean, you don't call and demand to play just a minute. No. As a matter of fact, we can't play just a minute today because we're out of time, right? Don't worry. Collins will play just a minute. Joyce will play just a minute. Sandra will play just a minute. The show is always quite, Tomorrow, we'll try and play just a minute tomorrow. Thank you all for being a part of the Morning Crossfire. Many thanks to our partners at the BBC Africa Eye. Many thanks to Aremeyaw for joining us. Big thanks to my team for putting this together. Follow Nigeria Info on Twitter at Nigeria Info FM. On Instagram is at Nigeria Info FM Lagos. You can listen to us live from our website, nigeriainfo.fm. I'm Sheriff Quadry. You can follow me across socials at Sheriff Quadry. I'll see you tomorrow at 5 a.m. Please don't oversleep. We start conversation as early as 5 a.m. Do join us then. In the meantime, Colin Stecker will be in here any moment now for What's Up Lagos. We have some commercials coming up and then the news at the top of the hour. Stay here on the nation's #1 talk station, Nigeria Info. Bye-bye.
Hello, I'm Sandra Ezekwesili, and you come